Okay, Assalamualaikum and good morning to Madam. Today I, Muhammad Arfan, Muhammad Shamil, Nur Haris, and Shaza Aiman will be presenting on our topic, First Aid and Emergency Planning. So now we will go with the introduction. So what is first aid? So first aid basically refers to an immediate care that is performed or provided to a person who is injured until proper medical treatment is available or when they arrive. The decision to act appropriately with first aid can mean the difference between life and death to a person.
Okay, now we go to the scenario one. So from this scenario one is about on the hike at extreme elevation, an adult leader starts experiencing headache, shortness of breath, and dizziness. He then falls to the ground and throws up. So how to handle this situation? First, you have to know the sign and symptom. So the symptom is the symptom of acute mountain sickness generally appear within hours of moving to higher altitudes. They vary depending on the severity of your condition. So if the person have a mild case, they may experience such as like dizziness, headache, insomnia, swelling on the hand, feet and face, and lastly is rapid heartbeat. Next, we go to Shamil.
All right, thank you. Second one, the prevention of the lack of prevent hiking of extreme elevation lah. So first check with a doctor. Second, do some aerobic training means do some warm up before you go into hiking. Third, slowly increase the distance and altitude of any training tracks. Means that you cannot just go to the maximum level of the hiking places, means the max top top of the mountain lah. So fourth, learn some yoga breathing rhythm, means that you must know how to breathe properly. Uh, that give you more benefit. Fifth, get used to drinking a large amount of plain water. That's before you're going to start hiking, make sure you get enough of water. And finally, spend time to acclimatizing to height, means that you spend more time to the high level of the uh, mountain lah. So the third one is the first aid management. For if you're going to lack of oxygen, give oxygen if available and keep the person warm and have him or her rest. And give plenty of liquid. Give acetaminophen or ibuprofen for the HS and avoid alcohol and sleeping medication.
Okay, so for scenario 2, on a walk through your neighborhood with friends, you find a man lying on the ground under a ladder. He is in obvious pain and his arm is clearly broken with a piece of bone protruding from the skin. How to handle the situation? So, sign and symptom include severe pain, which might increase with movement. Second one is swelling. Third, bruising. Fourth, deformity such as a bent arm or wrist. And last one is inability to turn your arm from palm up to palm down or vice versa. So for prevention, first one is to prevent falling. Wear sensible shoes. Remove hazard that can cause you to trip. Second, wear protective gear such as wrist guard for high risk activities. Third, never jump or slide down a ladder more than one rung at a time. Fourth, climb ladder slowly and deliberately, avoiding sudden movement. And last one is use tow lines, a tool belt or an assistant to supply materials and tools.
Now we'll be explaining on the first aid management. So firstly, we should stop any bleeding. So by applying pressure to the wound to prevent any loss of blood from the protruding bone. Second is to immobilize the injured area by using splint method if you suspect they've broken a bone, and in this case they have protrude a bone through their skin. Thirdly, apply cold to the area. So by wrapping ice pack or ice bag to the injured area for up to 10 minutes. Fourth, treat them for shock. So if the person is in shock, we should help them by getting the victim into a comfortable position and covering them with a warm blanket. And lastly, get professional help by contacting 911. So if the person doesn't appear to be breathing and is unconscious or both, call 911 for medical help and begin CPR. By begin CPR by doing a cardiopulmonary resuscitation, by doing chest compressions 30 times and giving 2 full breath. You should also call 911 if you suspect they've broken a bone in their head, neck or back. They fractured a bone. The fractured bone has pushed through their skin and they are bleeding heavily. And as a conclusion, every person should learn or take part on the basics of first aid so that they can analyze and perform first aid onto the person who just partake into an accident, so that they can reduce the injury or in some case save a person's life before proper medical care arrives. Reacting to a first aid position could also help others that are around the victim by clearing them from probably a dangerous situation or position. From the content above, we can see that it is important that we learn the basics of first aid so that we can perform our duty of helping someone who is injured. Thank you, madam. That is all from us.